In today's video, we'll discuss about the bullous pemphigoid. So basically, it is a chronic autoimmune subepidermal blistering disease of skin that rarely affects the mucous membrane. Now coming on to the pathogenesis. In pathogenesis, what we see is the IgG antibodies, autoantibodies basically, autoantibodies. They are specific for hemidesmosomal somal antigens of bullous pemphigoid 1 and bullous pemphigoid antigen 2. Okay, basically BP 180 and BP 230. Okay, now they are specific for it. Now what happens is they bind with basement membrane, due to which there is complement activation plus inflammatory mediators are released. Now these further release proteases. Now these proteases, they will degrade the hemidesmosomal desmosomal bone marrow, basement membrane, sorry, and then it will lead to the formation of blisters. Now it usually occurs in patients who are more than 60 years of age. Female and male predilection is not there. Also location, it occurs in inner aspect of thighs, flexor surface of arms, forearms, groin area. Now coming on to the clinical features. In clinical features, what we see is the vesicle and bullae, they are very thick walled, and the rupture does not take usually, like it does not happen usually. Also they rapidly heal, leaving behind a erythematous erosive scar. Alright, it basically starts as red eczematous plaque which changes into a bulla. Now in oral manifestations, what you will see is it is usually going to affect the gingiva. Now in gingiva, what will happen is it will be exceedingly painful and erythematous. It will desquamate after a minor trauma. Then you will have to remember that there is going to be other sites as well, in which you will remember the buccal mucosa, the palate, the floor of mouth, and tongue. Now coming on to the histopathology. Histopathology, what you will see is subepidermal vesicle, no acantholysis, fibrinous exudate admixed with occasional inflammatory cells. Also the basement membrane, it will show thickening and interruption in continuity. Alright, then after this, first in investigation, in direct immunofluorescence, what you will see is you will see IgG class in all oral mucosa biopsies. In indirect also, you will see that the circulating IgG antibody is there against the membrane, basement membrane. Now coming on to the treatment, basically it is an individual therapy which is given. Now in this therapy is for 6 to 60 months. Also what we see is after this many patients, they show recurrence. So this completes the Bullous Pemphigoid. I hope you understood. Thanks for watching.